Ashika, kindly start the session.
Hello.
Hello.
Yes, Ashika, kindly start the session. You are audible.
Okay. Good evening to one and all. So, welcome to Homeo Vision webinar series organized by All India Homeopathic Student and Youth Association. So, today's speaker is Dr. Pooja Fule, ma'am. She's assistant professor in the Department of Repertory in Dr.R and Lahoti Homeopathic Medical College, Sultanpur, Buldhana district. And today's topic of interest is unlocking the power of LM potencies, discovery, its philosophy, and practical use. So, over to you, ma'am.
Thank you, ma'am. Thank you for the introduction, and thank you all for joining me today's session. It's truly encouraging to see so many passionate homeopaths eager to explore one of the most refined tool in our healing system, and that is nothing but the LM potency. So, in today's session, it's not about only the different scale of potency. It's about the uncovering hidden gem from Hahnemann's final work, which is a key to treating the chronic diseases with gentle precision and the depth, especially in today's fast-paced and sensitive clinical setting. So we will go through the first part, that is discovery of potency. Second one is philosophy, and the third part is practical use of potency. So let's begin. So as we all know that the potency is developed, sorry, potency was developed by Dr. Samuel Hahnemann sir during the last year of his life when he was living in Paris during 1837 to 1843, which is published in 1921 in 6th edition of Organ of Medicine. You can refer aphorism number 270 to 271 to know about the LM potency, especially the preparation of LM potency. So why did Hahnemann develop this LM potencies? So there is some philosophy, because Hahnemann sir was not satisfied with the C potency because of strong aggravation in sensitive patient and so slow healing in chronic diseases, difficulty in frequent repetition and logics. And that's why Hahnemann sir invented a new potency that is called LM potency, which is gentle, refined, and flexible, especially in dose management. So now let's see what is LM potency. Hello, am I audible to everyone? Hello.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Now let's see what is LM potency. So LM potency, it is also called as 50 millisimal potency or Q potency. In this potency, we use one part of medicine and the 50,000 parts of different. And it is prepared, this LM potency is prepared from 3C potency, that is centesimal potency. So this is the LM potency. Now the question arises that who published the LM potency? So it is invented by Hahnemann sir, but this published by Dr. Richard Hale sir in 1921, and Dr. P. Skimdate, which was a Swiss homeopath, was instrumental in beginning Potencies into modern homeopathic practice in the year 1940s to 1950s. He translated Potencies in English, taught and promoted the Potencies worldwide. So this is how it is published after the death of Hahnemann, sir. Now let's see the benefits of potency in our day-to-day clinical practice. So it is very gentle and non-aggravating potency. We can repeat it frequently without any risks. Very suitable for the sensitive and delicate patient. Rapid healing in both acute and chronic conditions, and more individualized dose is possible in this potency. We can adjust doses, dilution, and succussions. So this is all about the discovery part of potency. Now let's see the philosophical part of potency, which is given in 6th edition of Organ of Medicine. So according to Hahnemann, sir, he has given us the aphorism number 2. That is, our ideal cure should be rapid, gentle, permanent restoration of the health. So because of this, Dr. Hahnemann, sir, invented potencies, and sir felt that this was the ideal potency as compared to centesimal potency, because its action is more gentle on the vital force. Its aggravation is very minimal, which Dr. Hahnemann, sir, observed that in C potencies there was a huge aggravation, especially in chronic diseases, and because of that, potency was the best medicine according to Hahnemann, sir. In this potency, we can easily give the repetition without any risks, and it is given in aphorism number 246 to 248. Hahnemann, sir, clearly mentioned that frequent repetition of this remedy is often necessary in chronic cases. Potency can be repeated daily or even in multiple times a day without causing any kind of aggravation. And this was only possible because of the succussion of dose before we prescribe any dose to the patient. Then this potencies dose is very flexible, and it is based on the patient's reaction. That means the sensitivity, response pattern of the patient, and the disease intensity. And for the practitioner, the amount of dilution, practitioner can adjust the amount of dilution, the number of succussions, and the frequency of repetitions. It reflects that it is highly dynamized, individualized, and the patient-centered method. And these are some aphorisms you can read from the 6th edition of Organ of Medicine. That is aphorism number 9, vital force as a spiritual dynamic entity. In aphorism number 246, you can read the modification of the dose and avoid the aggravation. In 247, the frequent repetition of dose in chronic diseases. 248, the liquid dose allows the safer repetition. And 270 to 271, that is preparation of potencies. If you want to more philosophy, then you can read all these aphorisms in 6th edition of Organ of Medicine. So this is the summary of potency. That potency is gentle in action, rapid in healing, individualizing in doses, dynamic in stimulation, and minimal material dose is used. That's why Hahnemann was in a favor of potency. Now let's see the preparation of LF potencies. If you have a TC potency, you can directly take 1 grain of 3C potency and dissolve in 500 drops of alcohol and take 1 drop from the solution and add 100 drops of alcohol and give 100 succussions, then you will get the LM1 potency. But nowadays, LM potency is easily available in our homeopathic pharmacy, so we can directly use poppy size globule to dispense our patient. And for further description, we can refer to episode number 270 to 271 and footnote to know about the scientific and rational thoughts behind the development of LM potency. Then how to administer the doses? You can give the doses through olfaction, oral, and aqueous solution. If patient is not taking by mouth, then you can apply this aqueous solution of LM potency on the palms of patient and the soles of the patient. You can repeat it daily, alternate days as needed, and the aggravation-free treatment is possible in LM potency. You can adjust the dose, you can adjust the succussions, dilution, and quality of dose. So for this, you can refer the episode number 246 to 248, that is repetition of dose, especially in chronic cases. And episode number 247, footnote, succussions before each dose and changing the quality of liquid to avoid the aggravation. Now let's see the importance of LM potency. So as we all know, the LM potency is very gentle and mild in action. We can easily prescribe this LM potency in sensitive individual, children, elders, and psychosomatic and chronic cases. Easily we can give the repetition in this LM potency to see the progress of the case. In today's modern lifestyle, we can easily practice this LM potency because there are a lot of suppression is going on and there are a lot of complex diseases because of stress, vaccination, and polypharmacy. So LM potency are well suited for for the treatment of autoimmune diseases, mental health issues, hormonal imbalances, post-viral syndrome, grief, and trauma. You can easily monitor the case during the course of LM potency. You can monitor the case closely, titrate the dose as needed, and avoid the sudden shift or aggravation. And you can easily give the quick response to your patient. Here, in this potency, we can reduce the risk of additional aggravation or tubing. Since the LM potency works gently and dynamically adjusted, the risk of overdosing, tubing symptoms, and long-lasting aggravation is very minimal. LM potency, psychological and emotional cases gives the good response, especially in cases of anxiety, depression, grief, mood disorder. In those cases, in these kind of cases, we can easily give the LM potency. And these potencies we can easily dispense through telemedicine. We can easily send at a long distance. It is cost effective, easy to send all over the world, and patient friendly in telemedicine setup. In holistic, integrative, and preventive healthcare, we can easily use the LM potency. If you are using LM potency, then there is a demand of evidence-based homeopathy. So with the help of LM potency, we can easily do the research in clinical cases, and we can easily collect the data. So this is also one of the most important thing we can do in LM potency. Now let's see the practical part of LM potency. What I have used in my case. So this is the case I'm sharing with you all. This is a patient of 52-year-old female came to me with the complaints of dry cough since 1 month, pain in throat, difficulty while swallowing, difficulty in speaking, feels better after warm water gargling or drinking warm water. Pain in multiple joints since 1 year. And she feels better in joint pain after taking warm bathing. So this was the case of sore throat and multiple joint pain. Patient as a person breathing with lukewarm water throughout year, planning prefers according to weather, being throughout year during summer, likes to cover with thin bedsheet, appetite good, thirst for 10 to 12 glasses per day, prefers to drink sips of water, especially warm water, because she feels better, desire for pure veg, aversion and disagree, not specific. Once a day, satisfactory, urine normal, 5 to 6 times a day, respiration, while working only, sleepless because of pain, dreams not specific, hobbies, household work, or and gardening. Patient said that she likes neat and cleanliness about home. She has a fear of cancer, that she will suffer from cancer. In past history, father had diabetes and BP, mother BP, and grandparents. She didn't know about the grandparents. Past history, files 4 years back, taken allopathic treatment. Life space in patient's ward. Now, everyone, please give your attention here, because you have to tell me about the rubric and your uh, thoughts on this case. So in patient, what patient told me that I have anxiety about my son because right now his business is not running good, and that's why she has a financial crisis. She told me that she has a lot of debt which she has to pay within a year, but her son business is not running well. And second, she told me that her husband is so nice, but he had an affair 3 years ago, and that's why she felt very stressed about those things. These are the two stress factors she has in her life. So mostly, and she told that mostly she think about the future, what will happen in her life. I asked her, why did you come to me? So she replied me, I want to take homeopathy for my joint pain, because I know painkiller will harm my body, and homeopathy doesn't have any kind of side effects. So I want to take homeopathy. Then I asked about the mind, asked about the basic nature. She said who wants cleanliness at home, becomes irritable easily in any situation, easily becomes anxious about the situation and future, easily mingled with people and religions. So now everyone, please tell me your suggestion. Which remedy is coming in your mind, or tell me about the rubric, whatever you are thinking. Hello,
Yes, ma'am.
am I audible?
Yes, ma'am. Please continue, ma'am.
Yes. Give your views.
Hello.
Hello. Yes.
Hello. Good evening, ma'am.
Good evening.
Myself, Nitish Kumar, and I am from Tamil Nadu.
Okay.
According to the case you said, we can think about mind fastidiousness, ma'am.
Okay. Very good. Anything else to feel?
Also, anxiety about finances, ma'am.
Okay. Nice.
Sorry to interrupt, sir. Actually, question and answer session will be held at the end, sir. So, as I already let the speaker, ma'am, complete the session, sir.
So, uh, hello.
Any issue, ma'am? Yes, ma'am.
No, you can take a question and answer session.
Okay, ma'am. Then fine, ma'am. Okay, ma'am.
No problem.
Wow.
Yes.
Okay, sir. Kindly put up your question, sir.
You can write your suggestion in chat box also.
I think sir may be writing, ma'am. Please continue the session, ma'am, so that in the middle, we will, if the sir asks the question, we will let you know, ma'am. Yes, ma'am.
So my totality of symptom was that fastidious, cleanliness, mania for anxiety about children, anxiety about money, anxiety future about throat pain, ameliorate by balm drinking, and ameliorate balm application. So this was my totality, and this was my final chart of the repertory. I am sharing the video of the patient. So please note that don't share this with anyone else.
ma'am. Any issue, ma'am?
No, it's okay, fine. Right now, I'm sharing the video of the patient after the treatment.
Okay, ma'am. Please continue.
So in this patient, I have given arsenic alp 0/1. What was my administration in this patient? That I have taken one 10 number globule of arsenic LM 0/1 potency and dissolved it in 100 ml of distilled water and added 1 to 2 drops of alcohol as a preservative. And I asked patient before taking each dose, give 10 types of suppressions and take 1 tablespoon from that medicine bottle and and mix it in another glass of 5 ml of water and take 1 tablespoon from that solution and discard the rest of the medicine. This was my administration to this patient. If you are thinking about how to give the frequency of doses in acute chronic or highly sensitive patients, so in acute cases we can do every hour or every minute, every 3 to 6 hours or every hourly or every 10 to 15 minutes interval. In chronic cases, we can do daily in BD, TDS or alternate days. In highly sensitive patient, we can uh, give once a week or less frequently depending on the reaction of the patient. If improvement is seen in patient, reduce the frequency or stop the dosing until improvement. So this is all about the today's session. So if anyone has query regarding this session, so please let me know. Hello.
Yes, ma'am.
Yes, ma'am. We can take the question answer session. Okay.
Okay, ma'am. Respected participants, if there are any questions, kindly comment in the comment box so that ma'am will be answering.
Yes, Dr. Arun Kavande, arsenic was the medicine. How to dispense? The question is here: how to dispense the LM potency medicine? So, if you have LM potency in a ready-made form, in pellets form, then you have to just take one globule of 10 number of LM potency and you have to dissolve that in 100 ml of water, add 1 to 2 drop of alcohol and give 10 times suppression. Then after that you can dispense your patient and ask them that give 10 suppressions before taking the dose. And then tell that patient that take 5 ml of medicine in half cup of water and take 1 tablespoon of medicine from that solution and discard the rest of the medicine. This is how I prescribe LM potency in my own practice. Any other question? Clear, Dr. Arun sir? Okay. Second, thank you, sir. Second question is that what points can be asked and noted in life space map? So I asked directly to the patient that is there any stress in your life? So she directly told me that she has a stress about her son, that his business is not running well, and that's why he has a financial stress. And second one, that her husband had an affair, and that's why she has a stress that might be her husband again betrayed her. And that's what that's why I took those points in my case history. So if you have a patient, you can directly ask about the stress factor of patient's life. So this is what I directly ask to my patient, or you can see the physical constitution of the patient. So Nitish, is it clear to you? Thank you, Nitish. Any other question? Yes, anyone? Do you have any query regarding the discovery, regarding the philosophy, regarding the practical part? Dr. Arpana, ma'am, held some cases related with LM potency. Ma'am, right now I'm using only LM potency in my practice. On daily basis, I'm giving LM potency. In this 50 sessions, I didn't add more cases, but definitely I will share the results which I have in my practice. Before yesterday, there is a maid in my clinic. She told me that she is not getting sleep since 1.5 months, and she's feeling nauseating. She has fever. She's feeling feverish. So she asked me, "Ma'am, please give me medicine." And prescribed her Pulsarilla 0/1. And today is the third day, and I asked her that how are you feeling today? So she told me since 1 month I didn't sleep, but after your medicine I slept well. I don't have any nauseating feeling. Even I'm eating very well and I'm working in a good way. So this is recent case which I have treated. If you want recording, I can share with you. Hello.
Ma'am.
Yes. Any question, ma'am?
As of now, the last question is only from the Parik ma'am, Arpana Parik ma'am.
Yes, I have a lot of cases, ma'am, but no, I didn't put those cases in. I have videos before and after.
Any other questions from the participants? Kindly comment in the comment box. Ma'am, I have a question, ma'am. What are the key points to be noted while giving this LM potency, ma'am, to the patient?
See, most important, this LM potency is very easy to dispense. You don't have any kind of fear to dispense these medicines. You can easily get the rapid gentle cure, which is told by Dr. Haniban sir. If you want to give the rapid gentle cure to your patient, you can prescribe the LM potency. You can give the repetition of doses as much as you require or your patient require. So these are the key points. So your patient will not suffer from any kind of aggravation and he will get rapid gentle cure.
Sure, ma'am. Thank you so much, ma'am.
Dr. Arun Gawande sir is saying that make another separate session, especially only on cases of LM potency. Sure, sir. Thank you, sir.
Sure, sir. We will invite madam for one more session, especially for the cases. Noted, sir. So, ma'am, can you share us some of your experiences regarding this LM potency in any of the patients, ma'am? How is your experience related to LM potency, ma'am?
Regarding my experience, LM potency, it is a very good response to LM potency. I have seen in C potency that you have to wait and watch to see the result. But if you are giving LM potency, then you can easily see the changes in the patient. Even patient can also see the changes in his or her complaints. Are the things which I have experienced in my practice.
Thank you, ma'am.
Right now, I'm only using LM potency to my patients.
Oh, majority of the cases are from which
Even
cases, ma'am?
even in acute cases, in chronic cases, I'm using only LM potency.
Oh, ma'am, what are the major chronic cases that we can use this LM potency, ma'am?
Any kind of chronic cases. It's
Oh,
not specific that you can give only in skin diseases, only in psychiatric cases, only in long-standing disease. You can give in acute as well as chronic cases in both. You can easily use in pediatric cases also. pediatric cases, gynecological cases, in each and every case. See, because of lack of knowledge, or because we can't give that much preference to LM potency in today's also, people are not using LM potency because of lack of awareness also. But really, Hariman sir gave us a golden key to us that you can treat easily any case with LM potency. Even you can give LM potency in cancer patient also.
Thank you so much, ma'am, for the clarification. So any other questions from the participants regarding the LM potency? So you can comment in the comment box.
Yes, please. If you have any questions, you can ask regarding philosophy. If you want to read more about uh, LM potency, then you have to go to the 6th edition of Organ of Medicine, that is aphorism number 270 to 271, which is related to the preparation of LM potency. And if you want to know more about the repetition, then you have to read about the aphorism number 246 to 248 about the repetition of doses. And you have to practice whatever written in our 6th edition of Organ of Medicine. You have to practice only that thing. The most important thing, we have to use single globule of 10 number, single globule of 10 number, which is very small. So you can imagine, most of the time that people don't believe that how this only single pipette can give the result in cases. But if you will dispense it, then you will know the result. If anyone is practicing homeopathy here and they want to see the result about LM potency, whatever the medicine you want to give to the patient in C potency, just try LM potency in your patient. And if you have any query, then you can contact me also regarding the dose or how to give the repetition. I will support you. I will tell you how to give the repetition and doses. Then you can see the result of LM potency in your practice too.
Thank you, ma'am. Thank you so much. Yes, ma'am. Please continue. Sorry to interrupt, ma'am.
Last 10 minutes is here. If you have any question, please let me know.
Ma'am, how about is there any gender equality, ma'am? Like any difference you have observed in males and females, ma'am, pertaining to the cure in either in acute diseases or chronic diseases pertaining to LM potency after you have prescribed to the certain patients?
No, as such, there is nothing. You can easily give this potency to each and every patient.
Okay, ma'am.
It's a form of medicine, na? So we can easily prescribe, just like we can give C potency.
Yes, ma'am. So thank you, ma'am. Thank you so much for this wonderful session. We will looking forward to many more, ma'am, and along with the LM potency cases, we will definitely have one more session with you, ma'am, especially for the
Sure,
cases and all, as per the participant
sure,
request. We will,
sure, ma'am. Thank you so much, ma'am, for inviting me on this platform. And thanks a lot to Dr. Arpana, ma'am, for inviting me on this session.
yes, ma'am.
Thanks to all the team.
Thank you so much, ma'am. It's a quite overwhelming session. And thank you all the participants for your active interaction. So we'll be coming back with the one more session tomorrow. So stay tuned for the tomorrow's session and we'll be right back. Thank you, ma'am. Thank you so much. Thank you all the participants.
Thank you.